So I organized some small presentations on data time. This is just a few slides, about 10 slides on sector time and Bomikine. Just a brief overview. Shall not go deep into the pharmacology because I know that you have it already, so I don't need to um, go into that. What is sector time? This is a presentation on sector time and Bomikine. Sector time and Bomikine. Sector time SB and Bomikine. So what about this? Uh, Ceftriaxone, of course, as we shall get to know later on, is ceftriaxone and sulbactam, and also Bomikine ranges. We shall be talking about these two products. It has an excellent DMF approved API that offer high quality products. DMF is a standard set by the EU and the US FDA, Food and Drug Authority. That standard says that these companies that make drugs to be given to humans should meet a specific standard of over 90% purity. The API here is the active pharmaceutical ingredient. So ceftriaxone and Bomikine meet over 99% purity according to the DMF approved policy of the EU and the US FDA. And this high quality promotes better patient outcome. And of course, I prepared this for prescribers. But how do these products look like? This is ceftriaxone. Those of you have ever seen it. That is how ceftriaxone looks like. And that is how Bomikine looks like. Different branches, different products. Someone can as well take flashes. So this is how this product looks like. We have syrups, we have tablets, syrups for Bomikine, the tablets, and the injections. This is an injection, this is the tablets and the tablets, but different SKUs. We have ceftriaxone 1.5 grams. Do I have something else here? Yeah, so this is how ceftriaxone looks like. These are visual aids. They call it visual aids. Yeah. So this is the look. Though I don't have the tablet form, but it's really wonderful. It looks so nice. It is film coated. I mean, silver coated, the packaging to protect it. And the Bomikine is made with an amber coating to protect it from sunlight because it is on the section is sensitive to light. Now, the purpose of this presentation is to present effective, anti-effective, and antiemetic therapies. It focuses on efficacy, safety, patient outcome that will later on influence the prescriber confidence. When your patient is okay, when you prescribe a brand or a product to a patient, and the patient gets better, you become confident, you become proud, you feel good as a doctor. Because when a patient, myself, I've also been in practice, and I prescribed for a patient a product. The patient came back very happy and even tipped me, and that is good. You feel like yes, you're really doing what you're supposed to do. But if you're prescribing something and the patient comes back without, comes back complaining, you feel bad, feel demoralized, you feel as if you don't know what you're doing, and yet maybe the problem may not be with you, but the problem may be with the drug. Maybe the drug is not pure enough, does not have the API is not so good. The API is not so pure. The active pharmaceutical ingredient in that is, is impure. Now, we shall of course discuss those two products. Now, what's ceftatime? Ceftatime is a combination of ceftriaxone and sulbactam. Like I said, we may not go deep into the pharmacology because all we know is that the sulbactam here protects the cell from degradation. We are fighting antibiotic resistance nowadays. And one of the mechanisms of fighting antibiotic resistance is prescribing beta-lactamase inhibitors together with the antibiotics, so that the antibiotics are protected, because we know that these microbes have developed a mechanism of fighting antibiotics that we give to kill them. So they produce beta-lactamase enzyme. Cephalosporins produce cephalosporinase, and the penicillins produce penicillinase, attacking the beta-lactam ring of cephalosporins and penicillins, respectively. But sulbactam here inhibits that enzyme, counters that enzyme, so CEF can properly do its job. Can someone take a pic of maybe that's a view? Just a pic of us. Be like this. Look. Yeah. You can use my phone. You have an iPhone.
No.
Just take some few flashes. So it's a broad spectrum. You know that cephalosporins, especially third generation cephalosporins, including ceftriaxone, are broad spectrum antibiotics, and they cover an extended spectrum of bacteria. Of course, as you know, of those generations, the higher the generation, the broader its activity against gram-positive bacteria. So as they move down the generation, the gram-positive activity reduces and the gram-negative activity widens. Cephalosporins here, ceftriaxone, is active against a wider range of gram-negative bacteria than less of gram-positive bacteria. Then sulbactam enhances activity against beta-lactam, beta-lactamase producing organisms. Then it's indicated for respiratory, among others, respiratory, urinary tract, skin, and systemic infections. So these are the clinical advantages of ceftriaxone. Excellent efficacy against resistant bacterial infections. Ceftriaxone is also regarded as a bomb to this bacteria. You get a patient with sepsis, you give ceftriaxone now, tomorrow the patient is smiling. Convenient dosing. OD dosing provides the convenience in drug administration, and therefore strong clinical outcome, reliable penetration in tissues, including the blood-brain barrier and also body fluids. Ceftriaxone is indicated for the treatment of meningitis. What are the microbes that commonly cause meningitis? We have what are these microbes? One is Neisseria species, I think. Then Listeria species. Yes, among others that you look for. Then it supports evidence-based infection control, so infection management. So that was about ceftriaxone. ceftazine. Third generation cephalosporin, broader activity, broader antibacterial activity, combination with sulbactam that enhances activity against beta-lactamase producing enzyme microbes, hence increasing its efficacy and effectiveness. Efficacy is effectiveness. Okay. Then let's look at briefly about vomikind. Vomikind ranges. We have different ranges of vomikind. Vomikind basically has ondansetron, which is an antiemetic used for pregnancy-induced vomiting, chemotherapy-induced vomiting, post-op nausea and vomiting, and gastroenteritis-induced vomiting. It is effective against nausea and vomiting. We have it in syrups, injections, and tablets. Then advantages of vomikind ranges. We have rapid onset of antiemetic action. It improves patient comfort and adherence, because when you have the different ranges, if a patient is vomiting now, in IMC we have that quote, vomiting now, convulsing now. So if a patient is vomiting now, you can give a what? IV. We have IVs of different strengths, 4 milligrams and 8 milligrams. 4 milligrams, of course, indicated for pediatric patients. The 8 milligrams are for adults. We have 4 milligrams per 5 minutes oral suspension for pediatrics, nausea, and also controlled periodic vomiting. Then we have the tabs, both 4 milligrams and 8 milligrams. Multiple dosage forms for various patient groups. Then it's also tolerable. We don't have the safety profile is good. The side effects are few, and it has gained physician trust. People who have used vomikind before can bear trust. If you have used vomikind before, you can bear witness that it's a trustworthy molecule. But why should you prescribe these molecules? High quality formulations with high quality formulations. You're welcome, Doc. High quality formulations with proven therapeutic efficacy. You get? High quality formulations with proven therapeutic efficacy. Supports faster patient recovery and improved outcomes. You need to look for, when prescribing a molecule to a patient, you need to look for high quality products. One of the companies with high quality products is Mankind. Mankind is number 3, rated the third in India. India has over 3,000 companies, each making drugs like this and sending here. And we don't have a mechanism to restrict or to monitor which kind of drugs enter our country. So anyone can make something and push here. But we need to look for which companies make which products that will help our patients. Mankind, you get other products from Zydus and Sun Pharma. Sun Pharma is one of the biggest companies there, trusted. So reliable safety profile and patient compliance. Ceftazine has a very good safety profile in our patients. The only side effect I see administering safe is vomiting. That is just that is one thing that I note. Vomiting, which is a tolerable factor. Then patient compliance. OD dosing provides that convenience in drug administration, and professional support and dependable products. These products, you can depend on them. You can give them and you trust that this patient is going to heal as long as your diagnosis is right. Now, ceftatim SB 1.5 milligrams offers effective antibacterial activity against organisms that cause serious infections, organisms with high virulence factors. Vomican dranges provide reliable control of nausea and vomiting. Together, these products support quality patient care. Is there any question? Thank you so much for listening. Unless you have questions. But me, I have something to discuss with you. Now, I'm here. I need prescriptions.
I have been prescribing these things.
I need prescriptions of ceftatim and vomican.
We no longer use Cefplay.
I always use ceftatim or vomican.
Ceftatim and vomican.
Yes, those ones are
That is impressive. And I thank you so much for prescribing ceftatim.
You're not going to find subjects on here.
Although the prescriptions, I don't know where they go. Because I expect that as you prescribe here, the prescription should be going to these pharmacies and they should be stocking. But I've been here 1 week. I've been in Kampala. I came here recently. So I've been moving those pharmacies, but I don't see. Maybe we need to increase the efforts.
And we prescribe and the patients first go to the inpatient pharmacy.
The inpatient pharmacy?
Yes, we
maybe they
the
change
system.
from there.
So, yeah.
But we have them in the system. We have vomican in the system, ceftatim in the system. We have ceftatim, we have vomican, we have even that Mahasef in the system. Then we have some antifungals. That I wouldn't really want to talk to you about. My major focus here is ceftatim and vomican. Yes, these two. But there is something here. How do you see Bactafuse B? Bactafuse B is a combination of fusidic acid and betamethasone. For now, this is the only the we don't have Bactafuse right now, but it's underway. But we have Bactafuse B available readily. A combination of fusidic acid and betamethasone. Fusidic acid is also known as anti-staph. Staph aureus is one of the microbes that normally reside in our skins. Now, when you cut the skin like this, you provide a portal of entry of what? Of Staph aureus in the skin, in the system. The systemic saturation, and also this causes what? Infection. It can cause systemic infections or localized infections depending on the immunity of the patient. You're welcome, Doc.
Thank you.
Yeah. So depending, you can have a seat here. So depending on the immunity of the patient, you either have a systemic or localized infection. The localized infection can be around the cut. So after you are cut, you can apply Bactafuse B. Bactafuse B. In gyne ward, OBS gyne ward, after cesarean section, mothers experience post-op itching always. Bactafuse B can become a drug of choice to control itching, but also, most importantly, to control localized infections. Yes. We don't have I don't have a sample for Bactafuse B, but next time, because I plan to be conducting this monthly, depending on your response. It will largely depend on your response, because this is, like I told you, it's a marketing activity. After this, you need to assess the progress of this. Yes. I will be giving you samples and all this. I also have OT caps. When you're doing a surgery, we don't want your hair to fall on the wound. Please use what? Use OT caps. Use OT caps. OT caps are also used by chefs. So if you have your wives or your wives, use OT caps because we've seen food. We found human hair in food. We don't want that to happen. So, but this is for theater. This is meant for theater. Yes. So I really need your commitment for Vomikind and Ceftatin. I need your commitment for Vomikind and Ceftatin. I need at least 5 prescriptions per day from each of you. If possible. 5 prescriptions. That will be a very good number for me. And will also, this is going to be a partnership. If this progresses very well, it will be a partnership between the company and you guys. It will be something to benefit. We shall have a mutual or a symbiotic relationship here. If we all do what? If we all work together, we need to work together for this. We need to work together for this. Vomikind and Ceftatin. Yes. I have a suggestion. I have a suggestion. One suggestion I have here is that.
Is he on the list?
No.
Like first
Let me
second
check.
one.
Yeah.
Let me check.
Ah, it's okay.
Yes. So,
Where is the list? The book. Let's get the book and to sort this. Several way be talking.
so I request that at least you give me 5 prescriptions per day from each of you. So, 5 prescriptions per day will do me. Yes? Yeah. Those who came a bit late, we were talking about ceftriaxone and sulbactam. We shared a little detail about them here. And I believe, but the central point here is that I'm seeking for your support for prescriptions of Cef and sulbactam. Sulbactam, that is Ceftatin, and Vomikind. We have these 2 products in the system, and you can easily prescribe them. If you find it possible, you can as well help me share these prescriptions. Yes, that helps me track what? Progress. It helps me know that indeed Dr. Khalif is prescribing. Dr. Ada.
Thank you very much. I think 5 prescriptions per day. Of course, some drugs I think can be possible, like antibiotics, Ceftriaxone.
Yes.
But
For Vomikind.
this one of Vomikind,
I understand.
are you getting?
Yes.
So the case normally we get combined issue of vomiting blood here in surgery than not much. I think this drug it is really matching the area is more on pediatrics and obstetric department. This drug,
I'm going to here, of course.
I think Ceftriaxone is logical, like that prescription.
It can be understood. I understand that. So these are some of the samples to get you started. Yeah. Then I have some stipend for you to keep you here for your time, but this is not the major stuff because I know good things are ahead. But you just need to show me that we can do this, we can work together, we can do this together. Okay? Then we shall, like I said, it will be a symbiotic relationship. We don't want to have a parasitic relationship. Okay? Yes. We want that when you go back home, you have something at hand. So I will have some 20K with you, for you, 20K for each of you, and this is just, to catalyze the process. Or because you already exported this product according to.
I think our recent colleagues who came,
Yes.
our colleagues, let's give some
An overview of what we have discussed. Dr. Yusuf, my name is Robert. Yes. I'm a clinical officer by profession, a tutor by profession, but also a public health officer. And now I'm doing business. I'm in business now. Yes. I work with Mankind Pharma. And those who did not register here, please. Those who didn't register, in the attendance list, I need to know who was around, who was not around. Don't move out because I'm going also. I just have like a few minutes, then I release you. You have to go and serve Ugandans. I also need to go and work.